Chad Williams, 18, is found by his roommate unconscious with an empty bottle of OxyContin nearby. The pills were his roommate's from his recent wisdom teeth surgery. After a rough first semester, Chad is on academic probation and has a history of depression. Now that he's homesick, he is having a rough time transitioning. He recently told his roommate that he is bisexual and doesn't feel like he is fitting in. After a few weeks, he perceives that even his roommate is becoming distant. He lacks a good family support system because he knows that his family does not approve of alternate sexual preferences. He felt as though leaving this world was his only release from the judgmental attitude of others and the overall stresses of his life. His roommate found him non-responsive on their dorm room floor and called 911 for commitment. He has been in the ICU, and after 72 hours, he is about to be admitted to a step-down observation unit.
Hi, I'm Kelly. I'm going to be your nurse today. How are you feeling?
I'm alright. I just feel a little nauseous, but better than I did yesterday.
Okay, are you dizzy at all?
Yeah, definitely dizzy. It's nauseous, but still better than yesterday.
Okay, good. I'm glad you're feeling a bit better. I bet your throat is pretty sore though.
Yeah, it's killing me. It's really dry. I don't really know why. Do you have something I can drink or something?
Yeah, we have popsicles in the freezer. I'd be happy to get you one in a minute, but can I ask you a few routine questions?
Well, I don't even know why I'm here though. What happened last night? I don't really know. I'm in a hospital, but why am I here?
Your roommate called 911 when he found you unconscious on the bathroom floor. You had taken a lot of pills and went into respiratory distress, meaning you weren't able to breathe. We put a tube down your throat to help you breathe because you couldn't breathe on your own, which is probably why it hurt so bad today.
What else happened?
We pumped your stomach to get the pills out of your system and started you on an IV of fluids to rehydrate you. You're unconscious, so we let you rest overnight in ICU. We'd like to move you to a step-down unit today, but first can I ask you a few questions so we have the authorization to move you?
Sure. Can I get something cold first?
Absolutely. I'll call and have a tech bring you a popsicle. Is orange okay?
Yeah, that's fine.
Okay, give me 1 second.
Nurse Kelly is about to begin a standard suicide assessment.
Okay, they will be bringing your popsicle in just a minute. I have a couple questions for you, but they won't take long, I promise. Okay, how do you feel in general about what's going on in your life now, as well as what could happen in the future?
Honestly, it's really crappy. I don't even know how to sound.
Crappy, huh? I'm sorry to hear that. Is there anything you'd like to talk with me about?
Well, it's been a really rough couple of weeks. Nothing's really going my way. I just had midterms. I'm pledging right now. My family's never happy with me, and I'm just done.
You're done?
I'm just sick of my family. They don't appreciate anything I do, and they don't really appreciate me for who I am.
It sounds like you've had a lot on your plate. So what I hear you saying is that you've had a lot to deal with these last few weeks, and you aren't quite sure how to deal with it. Have you thought of any ways to deal with all the stresses in your life?
Well, I can't talk to my blood brothers about this stuff, and my family doesn't approve of it. It's not like I'm going to go to my parents and talk to them, so I don't really know what to do.
So you're looking for some support?
Yeah, I guess.
Well, why don't we talk about it, you and me? Is this something you would be comfortable with?
Yeah, it's fine. This is going to sound really weird, but I don't know. I'm not really sure about things anymore right now. I think I might be bisexual, but it's not really something that I'm okay with or my family's okay with, and I don't know. I feel like they'll be really just disapproving, and I don't know. Anything that's not traditional, my family is not okay with, and I just feel like I'm at that point where I can't do anything else, and I should just give up.
I'm so sorry to hear that, but I'd be happy to connect you with some resources at the LGBTQ Center here on campus. Giving up is really serious stuff. Have you ever thought about harming yourself as a means to cope with your situation?
How did I get here? So that obviously was not an accident. I knew those pills were there, and I knew what they could do, and I went for it.
So now that we've seen our suicide case study, we now have a presentation over what suicide is. We have some statistics for you guys, and you can feel free to ask questions. We have some as well. Okay? So, first question. In this situation, what would you do? And how would you classify Chad?
I would probably classify Chad as being emotionally unstable.
He's pretty depressed, it seems like.
Yeah.
Actively suicidal.
What does that mean?
It means that he's out of the stage of thinking about committing suicide and he's actually attempted it.
Okay.
Yeah, there's definitely a difference between thinking about suicide and like actually trying to kill yourself.
He's a danger to himself.
Okay, good. All of those are very accurate. He is in the active stage of suicide. He is a danger to himself, and his depression and his emotional instability has not been helping that, for sure. Okay? So we have some statistics on suicide. These are from 2007. 11.3 suicide deaths per 100,000 people. Also in 2007, there were 14.3 suicide deaths per 100,000 people 65 and over. Firearms are most common for males at 56%, and poisoning in the form of pills is most common for females at 40%. The most common age for suicide is in young adults, age 20 to 24. More common for American Indians and non-Hispanic whites versus African Americans, Hispanics, and Asian and Pacific Islanders. Risk factors of suicide: depression or other mental disorder, kind of like Chad. Substance abuse, violence in family history of suicide, firearms present in the home, prior suicide attempt, and incarceration. So as a nurse, how would you handle the situation?
I would definitely listen to him and make sure I'm there so he can talk to me if he ever needs it. That's very supportive and accepting of him to be how he is fragile. He needs to be monitored and closely too. I would help him make short and long-term goals so that after he leaves the hospital, he knows how to go on.
What kinds of goals do you think?
Maybe like ways to find support, because he obviously lacks a support system, so like call a friend or talk to his family or something along those lines.
Okay. Well, I actually have some goals that we could talk about today. So we do have both short-term and long-term goals available. So first, for some short-term goals, he should schedule an appointment with a psychologist and a psychiatrist. Sometimes having multiple opinions can really help. He should also stop by the LGBTQ Center for more information. He could talk to his frat brothers or close friends, and then set aside 1 hour per day to study so he can improve his grades and get off of academic probation. And then he also needs to make a suicide contract in order to agree not to commit suicide until after his next appointment. Okay? So then some long-term goals that we have for him are attend therapy 4 times per week for 3 months, and then once per week for the next 3 months, and then once per month for the next 6 months. So for an entire year, he is going to therapy, and it tapers down as the year goes on. He should consider coming out to close friends and family and be comfortable with the coming changes. He should join a support group and get involved. He could go to the gym, he could join some clubs, just basically anything to help him get more involved. He can improve his grades and get off of academic probation. A lot of that has to do with studying more, making more time for school and less time for just, the party life of the frat. And he, at the end, can forget all suicidal feelings. Okay? So here we have a nursing care plan for Chad. It includes diagnoses and outcomes of his situation, and we will discuss this, and feel free to take a look at it. Okay, so last but not least, if you or a friend is suffering from suicidal thoughts, there is a suicide hotline that you can go to. There's one for the United States and also for the University of Missouri. All hotlines are open 24 hours a day, 7 days a week, and you can call for yourself or for another person at risk for suicide or self-harm. Okay? Any questions? Perfect. Well, thank you for participating.